my dance make it hurt.
As you can see, I work in the health field, and from the title of the video, you may already know what we are going to be talking about today, which is my job. I work in the field of medical technology. Now, medical technology can be referred to by the terms laboratory medicine, clinical laboratory science, or biomedical science. But for the purposes of this video, I will refer to it as medical technology. So, medical technology plays a very crucial role in how we detect, diagnose, and treat diseases. So, at its core, what we do in this profession is that we collect mostly body specimen. We conduct testing such as biologic, microscopic, immunologic, molecular diagnostic, chemical or hematologic testing on the specimen that we collect, so that we can assist doctors and other health practitioners in the treatment or diagnosis of diseases that humans face daily. The most interesting part of this job that I can say personally is the testing phase, where we analyze the results and we relay those results to the health practitioners and medical doctors. And they in turn use these results to make very informed medical decisions with respect to patient care and treatment and diagnosis. So you may ask, what does this entail really? So at its core, it's 5 disciplines. In the US, it's 4, but I was trained in the Commonwealth. In the Commonwealth and other British territories, you will be trained most of the times in 5 disciplines. So I'm just going to tell you the 4 first that are done in America, and then I'll go to the 5th one. So, a brief synopsis of each. So we have clinical chemistry, which is the study of analytes in mainly blood, and serum, which is used to determine, monitor, or to assist in treating patients in particular disease states. We have medical microbiology, where we study microbes and how they affect humans and cause disease. We have hematology, where we study cells within a particular cell line and how these contribute to disease states. We have immunohematology, which is also known as blood banking, where we basically break down the blood in its components and use each component to assist in treating disease. A big part of immunohematology as well is antibody to antigen reactions. Now, those are the 4 that you would be exposed to if you were in the United States. Now, if you are trained in the Commonwealth like I was, you'll be introduced to a 5th discipline known as histopathology. And that basically deals with particular types of tissue. It's the only one of the disciplines that you will do most times on a dead specimen. And when I say dead specimen, it can be a specimen that is linked to someone or something that may not have life anymore. For instance, if you have removed an appendix in a surgery because it was going bad, it would be sent to histopathology to ensure that they cut the correct thing. Another example can be like when men who decide to get a vasectomy and the doctors go in and snip, a sample is usually sent to ensure that they have cut the correct thing. And it's normally like a confirmatory thing. Other times it can be used to determine how drastic a cancer is, how damaged a particular tissue is, and so on. The most interesting thing about that discipline is that they use stains, and depending on the part of the tissue, it will take on different stains. That is not the only discipline that uses stains, but I think it's the most interesting thing about that discipline. Some of the subdisciplines include immunology and serology, which has aspects of clinical chemistry and hematology, but they can stand alone by themselves. So immunology, one thing comes to mind when we talk about immunology is the ELISA method, which I will go in depth with in future videos to come, as this is just an introductory video. Now you have other subdisciplines like toxicology, that is basically, in simplistic terms, how poisons or other drugs can affect the body. So in toxicology, a doctor may want to know what level is my patient's vancomycin at, so that I can either introduce more drug to the patient or hold off some more drug so that it can be at a therapeutic level. And therapeutic level just means that they want the drug to be at a level where it helps the patient and does not harm the patient. Another subdivision is urinalysis, and by the name, it's just analyzing urine for analytes and other things that may present in urine, such as crystals and other sediments. And a very big subdivision, in my personal opinion, is molecular diagnostics. Now, this can relate to all or some of the core disciplines, as molecular diagnostic can be a method that we use to arrive at a particular result. So it's a very interesting field. I love what I do, and I believe that, it is not a very upfront job, I must say, because we are always in the shadows doing what we do best. But I believe that it's a very, very fulfilling profession. I really love what I do, and I think that what we do is very important. Not to say that we are the most important, but in health, you work as a team. So you need medical technologists, you need nurses, you need nurse practitioners, you need pharmacists, you need everyone to play their role so that the patient at the end of the day can pull through whatever disease conditions that they are going through, and they can become healthy again. So, what do you think? Do you think that, based on what I have said so far, it's a very interesting field to go into? Maybe you are considering to be a medical technologist. Maybe you have never heard what medical technologist is. But I hope that this short introduction may enlighten what you already know, or enlighten you further if you were not aware of what medical technology is. So until the next one, see ya. Thank you so much for watching my video to the end. I really appreciate it. Go ahead and follow me on all socials at Asa the Great. That's Asa the Great on all socials. Go ahead and hit that subscribe button and subscribe to my channel, and hit that notification bell to know when I put up new content. Always remember, never forget that the greatest discovery of all time is to realize that you are your greatest asset.